afternoon, my name is Maricar Carino from BSN 21 and today I will be performing hand rubbing. The purpose of hand rubbing is to reduce the number of microorganisms that is on the hands and to reduce the risk of transmission of microorganisms from the nurse to the client and vice versa. In a community setting, it is more preferable to do hand rubbings since there is a less availability of materials such as running water and soap. For the assessment, assess the patient if there's any presence of factors increasing the susceptibility to infection and possibility of undiagnosed infections such as HIV, use of immunosuppressive drug, if there is any recent diagnostic procedure or treatment that penetrated the skin or body cavity, if there's any signs and symptoms of infection. For the healthcare worker, assess the nails if they're properly trimmed, if there is no nail polish, and if there's no wounds or cuts. Check the availability and functionality of the facilities and supplies that are going to be needed. For the planning, gather and prepare the following materials: soap, running water with desired temperature, disposable or sanitized towels, one pair of surgical gloves, and tissue. But since we're doing hand rubbing, we need to prepare some alcohol or alcohol gel. It's more preferable to use alcohol gel since it's more moisturizing to the skin compared to the alcohol that is more drying. To begin with the procedure, assemble all the materials and supplies that are going to be needed, such as alcohol. Remove and secure all loose items such as name tags, jewelries, and wristwatch. Begin by applying a palmful of product on a cupped hand, making sure to cover all surfaces. Start with palm-to-palm rubbing, with the right palm on the left dorsum with fingers interlaced, and then vice versa. Palm-to-palm with fingers interlaced. Back fingers on the opposing palm with fingers interlocked. Rotational rubbing of the left thumb clasped in the right palm, and then vice versa. Rotational rubbing of backwards and forwards of the clasped fingers of the right hand on the left palm, and then vice versa. Once our hands are dry, they are now clean and we are now ready to proceed with the next procedure. This procedure is usually done 20 to 30 seconds in order to make sure that our hands are clean.